Now, just to end my presentation talking about CSOM without cholesteatoma, I just want to use this database to a very short demo on, let's say, results in case of Austin cartouche group A, with the use of simultaneous malleus relocation and sylastic bending technique. You know, when I use a torque despite the presence of a staphyloid arch, and I put the torque from the malleus to the stapes foot plate. So in that case, I just want to remove. I don't want to talk about second stage. Well, let's put in that. You can decide to remove it if you want later. But first, let's go and go to then osteoplasty. And then I'm going to select Austin cartouche group A, which means malleus and stapes present, 1,218 cases. And now I go to surgery. I go back to surgery, and I have to select a case of in the list of associated surgical technique. Then I have to first click on osteoplasty, because there are cases where I didn't do the ossicular reconstruction immediately, probably because I staged the surgery. So let's go and click on osteoplasty first. So these are selecting only 1,206 ossicular reconstruction in Austin cartouche group A within my entire groups of tympanoplasty. And then I will go to associated surgical technique. So we have malleus relocation and sylastic bending. So it means, of course, there are more malleus relocation than sylastic bending, because this technique of sylastic bending, I introduce it later on. But I want to study both together. So I cannot select this one and this one, so I need to remove the other one. So let's remove this one, grommet insertion. Remove, now so we have malleus relocation, sylastic bend still there. So I want to remove node. Then I click, and then I'm going to remove section of the neck of the malleus. These are some case of revision, so I remove that, and now I'm going to remove what I call opening of the stapes head. This is the very ancient technique I was using in some very few cases. So we have now 866 cases of malleus relocation, 718 cases of sylastic bending. So of course I want to remove the one which were not with sylastic bending, so I'm going to click on sylastic bending, and now we have 718 cases of sylastic bending and only 626 cases of malleus relocation. So it's clear that now if I click on malleus relocation, I will select specifically the group of sylastic bending plus malleus relocation. That's it. So we have 626 cases here. You can see malleus relocation and sylastic bending. So definitely this is what we have. And again, let's say I just want to be sure that I was using a torque in all cases. And you see that there's a line here, position of the prosthesis, where despite the fact that I was relocated the malleus, I didn't put it on underneath the malleus. So I just want to remove that. And this is probably, and then we have malleus to mobile foot plate, definitely 624 cases. And then if I click to with pre and post-op, then again we have that, and I can change with the post-op hearing threshold, everything you need to publish this paper. And if I want to get my results at 1 year, again I will click on 9 and 18, and then I click to follow up. And then we have now of this more than 500 cases, we have 269 available data at 1 year. And then within this group, if you want to refine, you can specifically select a cohort of patients between 10 years, 9 and 10 years, for example, then you can refine that. Okay, so I think it's fine for this group. I think I enjoy demonstrating this different way of using the database, but of course, I just want to demonstrate that with my own database, with my list of patients, just to give you an idea, an overview of the power of this database. So now that was the first part of my demonstration, just going directly through the statistics. Then I will go to how to export the data later on. And then the last part will be, of course, to demonstrate how to enter a new patient, how to enter patient information, audiometric data, pre and post-op, how to end the post-op clinical items, findings, when you see the patient back after 3 months, 1 year, 5 years. And also I will go and demonstrate how to change everything in the program. If you don't like the information which were already preloaded, you can change everything and insert your own terms, your own classification, your own prosthesis, anything you want. But I need to make another demonstration and tutorials. So there will be few more tutorials later on. Okay, I hope you enjoyed it again, and I see you later.